Evening, wonderful nurses and midwives. How are we all doing? Welcome back to Brainy Academy. Firstly, we acknowledge God. In this academy, we always acknowledge God. So we thank God for everything. The students that wrote their exams, we give God praise. Many students passed, and many students were congratulated in the academy. So we give God Almighty all the praise. So now we will not we have a lot to cover, so we'll be combining quizzes and lectures together because we have a lot to cover. Now, one of the reasons why the academy is using this quiz platform so that we'll be covering a lot. Now, after each quiz, you are to notify me. You are to notify me the the places you find difficult. All right, the quiz will help us cover a lot of topics from now till when you write your exam. All right, so now, in each quiz, you are to notify me if you grabbed what the quiz is all about. Like today's quiz will be specifically on the eye. So it will be med surge. Now, we'll be doing a lot of med surge. We'll be doing a lot of med surge here, but every other topics and every other course, anatomy, pharmacology, and all quality improvement, PMT, will be done in the private Telegram group. But we'll be doing a lot of med surge here so that we can cover a lot before the exams. We'll be doing med surge here, basically quiz and viva here, so that we can cover a lot. Now, if there are places within the quiz and the question that you don't get, you just need to notify me in the WhatsApp message so that I will do a detailed lecture on that med surge aspect, that disease condition. Now, I want us to answer these questions. You are a nursing student or a midwifery student, so these are conditions you will see in the hospital. Like I said, what we are doing today is basically on the eye. So we'll be picking disease conditions. And this quiz is a sort of a lecture, but it's just a quiz to test your knowledge first before we make a detailed, simplified lecture on it. So I want you to get your pen and your book, and we will score it in the WhatsApp group. And also, you can also drop your answers there. So, number one question: arthritis is an inflammatory condition of the eye that specifically affects the. So, arthritis is an inflammatory condition of the eye that specifically affects the. Now, I want you to drop your answer. Now, as we are doing this quiz, I want you to learn how to answer questions fast also. I want you to articulate fast, to think fast, and drop your answers. So, get your pen and be writing the answer. So, my question: arthritis, I'm impressed. The student said iris. Now, let's know if she's correct. Now, if you choose A, cornea, you are wrong. If you choose C, retina, you are very wrong. If you choose B, which is iris, you are correct. So D is not the answer, A is not the answer, but B, iris, inflammation of the iris is called arthritis. Now, number two, a patient suffering from arthritis commonly present with a symptom characterized by severe eye pain that becomes worse when exposed to light. This condition is best described as, now think rationally. A patient suffering from arthritis commonly presents with a symptom characterized by severe eye pain that becomes worse when exposed to light. This condition is best described as, and you have some seconds to think. Now we are practicing how to answer questions fast for the nursing council. So give me your answer. You have some seconds to think. I believe you've, all right, a lot of students. I'm impressed. Now, if you choose A, painless eye discharge, you are wrong. If you choose C, you are wrong. If you choose B, you are correct. So the answer is what? B, severe eye pain with light sensitivity. Very correct. I'm impressed. I have so many intelligent students here. All right, so let's continue. Now, 3. In clinical eye conditions such as arthritis, the term photophobia is used to describe a situation where the patient experiences, in clinical eye conditions such as arthritis, the term photophobia is used to describe a situation where the patient experiences, and you have some seconds to give me the answer. Is it A? Is it B? Is it C? Is it D? Very correct. Now let's examine the answers. Now, what are we noting? Though we will still have a class on this in the Telegram group, but what are we noting now? We are noting that iritis is inflammation of the iris. Don't forget it. That is why we are using this method. Now, there is always sensitivity when it comes to iritis. So in your exams, anything sensitivity goes with what? Iritis. Are we together? So number 3 answer, if you choose C, you are wrong. If you choose D, eye swelling, you are wrong. Loss of vision, wrong. That is not retina. If you choose fear of darkness, you are wrong. So the right answer is what? B, sensitivity to light. Now, the last question on iritis before we dive into some other disease condition of the eye, which you've not heard of, probably. That's why we are doing it. Now, number 4, iritis is medically referred to as an inflammation affecting the anterior part of the uvea tract, and it is also known as, iritis is medically referred to an inflammation affecting the anterior part of the uvea tract, and it is also known as, is it glaucoma? Is it cataract? Is it anterior uveitis? Is it conjunctivitis? Let's see those that will get the right answer. Now, you should know what is the uvea tract. You should know what the uvea tract is. Don't forget it. So if there are places you want explanations, please be noting them down. Okay, I'm impressed. I'm impressed. I'm seeing different um, opinion. Now, if you choose conjunctivitis, you are wrong. You failed it. And if you choose cataract, you failed it. And if you choose A, because I'm seeing opinion between A and C. Now, if you choose A, you are also correct. So the right answer is what? A. Glaucoma is wrong. That's not the answer. So the student that just chose glaucoma is wrong. So the right answer is what? Anterior uveitis. Why? Because iritis is the inflammation of the iris, which is in front. Anterior means front. All right, that is why it is called anterior uveitis. Now, for your note, what you are jotting down, another name for that inflammation of the iris is anterior uveitis. So you should need to write it down. You need to note it down. So it is not glaucoma, it is not cataract, it is not conjunctivitis. Now, let's dive into places you've not heard of before, because these ones we just discussed on now is a bit simple. Now, number 5, for all the students that has been getting it so far, I'm impressed. For not that means we might not have a class on iritis. Now, number 5, a painful red swelling that appears at the edge of the eyelid is medically caused by infection of the a painful red swelling that appears at the edge of the eyelid is medically caused by infection of the. We have A, retina. We have B, eyelash follicle. We have C, cornea. And we have D, iris. I come again. A painful red swelling that appears at the edge of the eyelid is medically caused by infection of the A. We have retina. Now, students need to know the parts of the eye. B, we have eyelash follicle, and C, we have cornea, and D, we have iris. All right, the right is generally identified as the microorganism most commonly responsible for causing a stye infection is generally identified as. Can you hear me? Are we still together? Are we together? A micro The microorganism most commonly responsible for causing a stye infection is